The Michael Berry Show.
First, let me give a little context, shall I? Because this one's out of left field. Unless you really know me and my goals for this show, and then it makes absolute sense. So my mom passed September 19th. You know that. And my dad was there, and we had caretakers around the clock, but he was there by himself. And my brother's not there anymore to swing by and check on him. He's a very, very severe diabetic. His blood sugar can get really low. He can end up in the hospital. He has over the years. So we made the decision to bring him in Houston. And we found a great institution. We looked everywhere. We talked to everybody. And boy, did it ever turn out to be the right choice for us. But you worry. And it also happens to be walking distance from where I live. So I can stop in on him all day, every day. Why is he not at my house? Why would you put your dad in a facility? Well, a couple of reasons. But most importantly, because they have 24-hour care, and we couldn't provide that. We travel a lot. So it's turned out to be great. He's happy. I'm happy. But we had all these doctors that he had in the Golden Triangle. For those of you who don't know where the Golden Triangle is, Orange, Beaumont, Port Arthur. It's southeast Texas on the Louisiana border. So we needed to find doctors in Houston, and that's kind of my specialty, is I like to find good doctors and reward them with lots of referrals. So I called around various doctors, and I asked for suggestions. And one of them that was suggested to me was by my cardiologist, Dan Dukeman. He said, hey, I got a guy that I know named Jay Davis. He's a concierge doctor. I wanted a concierge doctor, but he said he's a concierge doctor, but he's got a partner in his practice. Her name is Anu Davis, A-N-U. It's an Indian name. He's got a partner named Anu Davis, and she's great, and your dad would love it, and you would love her. So we tried her out, and I told you the story. My wife took him for the appointment. Now she comes to his old folks home. She will come to the old folks home. She'll make house visits. She's now one of my wife's many doctors. So anyway, she walks in and she's sitting on her butt, Indian style, appropriately, Ramon. She's sitting on her butt. She takes off his socks and she's rubbing his feet. If you know anything about diabetes, you know that you don't get circulation to your toes and you end up losing your toes. She is looking for sores. She's talking about his feet, but she's lovingly caressing his feet. If you don't think that I wasn't locked in, send me whatever bill you want, lady. You are touching my dad's feet and loving on him, and he's 85. You have won my heart, right? So we really like him. We really like her. Concierge medicine is very different than the traditional medicine you're used to. You can call these doctors, and you have their cell phone number, and so my dad does. Hey, I called Dr. Davis. I'm like, Dad, don't call her too much. You know, she's got other patients. So we have a dinner party, and at the dinner party, I put myself right next to her because I still haven't met her through all this, but we've had text conversations and phone conversations. And I put our boyfriend on the other end of the table and my wife next to him. And then we had some other friends in between. But I'm focused on her. I want to know about her practice, what she does. I'm fascinated by this stuff. And at some point, I said, how'd you get into diabetes? What's your passion for diabetes? She said, my passion is for diabetes, and I love treating diabetes. But if you were to ask me what my number one passion, and I can have several, it is menopause. And we started talking about, as an endocrinologist, the glands, thyroid and adrenal. You don't know your glands, Ramon. You need to learn all your glands because otherwise you can't have a dinner party with her. And we started talking about women's hormones. So I'm fascinated by all this because I just like to learn about everything I possibly can from people who know things. So we're laying in bed, and my wife said the next morning, she says, I don't know if you noticed what happened at the party last night, but when Anu started talking about menopause, every woman leaned forward and all of our other conversations stopped, whereupon the men leaned forward and they started listening about menopause. And I said, no, I didn't. Why do you think that was? She said, it's a topic nobody will talk about, and everybody's affected by it, and everybody's interested in it. You should have her on the air. I said, well, let's be clear right now. Know your place, woman. You don't tell me what to do on this show. So our guest is Dr. Anu Davis, and it is my honor to have her on. I've become a fan. Let's start with this very simple question. And by the way, if you want to look her up, it's River Oaks Doctors Group, but her name is spelled A-N-U. She won't be the only Anu. Anu is short for Anura. That's a very common Indian name, but it's Anu Davis. I guarantee she's probably the only one of those. So let's start with a very simple question. What is menopause?
So, Michael, thank you for having me on, and I'm excited to talk to you about and answer all your burning menopause questions. So, first,
Well, my
I guess
burning
the most
questions are
simple, the
related to a
first,
UTI, but that's a whole different question. Go ahead.
well, those are different questions, but your burning menopause questions, you want to know the answers. So, the most important first thing is to actually know what menopause is. So, menopause is the point at which women stop having cycles and menstrual cycles, that is. And the once a woman has not had a menstrual cycle for 12 months, that's when she's called in menopause. The big issue with all this is women's menstrual cycles can start changing up to 10 years before the cycles actually stop. So then the whole time before that is called perimenopause. So that's what we tend to be talking about is perimenopause and menopause, and
Okay,
then the
I've heard
time
that. I didn't
after
know
the
what it
cycle
meant.
stops.
Is that about a 10-year? Is that happens about 10 years before she goes into menopause?
Well, sometimes it can be a nice, happy 12 months of stuff. Sometimes it can be up to 10 years. So somewhere in the 4 to 10-year range is what perimenopause can be. But
Okay.
up to 10 years of fluctuation and transition before the actual
Okay.
pause happens.
All right, go ahead.
And then menopause is the 20 or 30 years that women live after the cycle stop. Then they're considered to be postmenopausal, and that's our job is to maintain health through that 20 or 30 years. So when people start talking about menopause or perimenopause, the words are often interchangeable, but menopause itself is when the periods stop for 12 months.
Okay.
Yeah. Okay.
And is that just nature's way because we probably weren't meant to live this long, that a woman is beyond her reproductive life and so there's no need for that cycle? And let me just say before we start, first of all, I'm a dude, so never having gone through that, we all know it secondhand. I'm trying to. I have had a lot of women tell me they are excited to hear what you have to say and to learn more about this, and they're glad that it's being discussed publicly, including some folks, some rather prominent folks that surprised me they were willing to put their name behind this, but I'm not going to say their names, who were quite interested to learn more. But we will talk more to Dr. Anu, A-N-U, Davis of the River Oaks Doctors Group about, menopause. That's what we're talking about. Coming up. I don't care if somebody disrespects you. You can't shoot them.
The Michael Berry Show. Your ghetto pass has been revoked.
Dr. Anu Davis is our guest. She's a menopause expert, River Oaks Doctors Group. She's in Houston, and this is something she is passionate about, is treating women with menopause. And my question was, do women stop having a menstrual cycle because they are past the age that they should be or typically giving birth, or is there some other reason?
No, it's a natural process, okay? The periods stop because you're past reproductive age. The issue is that we live for another 30 years after that, right? Our life expectancy is 75 to 85. So in that 30 years, we want to maintain our health. There has been a lot of issue and discussion about whether these hormones are useful and what happens and how do we maintain women's health in that 30 years. Because we all want to be upright and functional and thinking straight. So that's the reason that menopause gets so much discussion, and what happens to women's hormones and how do we treat this, and what other symptoms and issues come up because of it.
And what are these hormones that we're talking about? What do they control? Is this sexual drive? Is it diet? Is it, when my mom was 40 in 1985, I lost my mom, and a crazy woman poltergeisted into her body, and she screamed and hollered. And when we would go, "Mom, what in the world?" And she'd say, "I'm going through menopause. I'm having hot flashes." Can you talk through that? Because I can be as clinical and not silly as I want to be, but there's a lot of dudes going, "Can you explain to me what's going on with my wife right now?"
Well, so we know that hormones fluctuate all the time. But as the hormones decline, we have realized that there's estrogen receptors everywhere. And so the hot flashes and the night sweats, that's the first thing that we talk about. But the mood stability can become a problem. Sleep can become a problem. Women start to have joint pain, vaginal dryness, pain with sex. There's up to 100 different symptoms that can occur as the hormones are fluctuating and declining. So that's the problem. Women are suffering, and it's making them less functional.
So that's obviously. Sorry. Go ahead.
Yeah. So there's lots of different things going on, and the big question is, is replacing these hormones? It's been taboo for a long time. And part of the reason for that is because there was a big study that came out in 2002 that called the Women's Health Initiative. And when that study came out, because of the way the study ended, it was publicized that hormone replacement is bad and that hormone replacement causes breast cancer and increases cardiovascular disease. So when that happened, the women who were on hormone replacement at that time for treatment of their menopausal symptoms, the rate of hormone replacement went from 40% of women post-menopause were taking hormone replacement to something like 5 to 6%. The guidelines from all the medical societies came out that hormone replacement causes breast cancer. So for 20 years, many women did not receive hormone replacement that they received because the doctors were taught that hormones cause breast cancer.
In your professional judgment, do you think, though, that hormone replacement causes breast cancer?
Hormone replacement does not cause breast cancer. The reason some of this has come to light in this last year is because in 2024, last year, they came back and reanalyzed all the data from the Women's Health Initiative. And so now, 20 years later, they've come back out and they've started talking about how the data was analyzed incorrectly. And they've come back out and said, well, women's hormone replacement does not cause cardiovascular disease. It does not cause breast cancer. And for those of us who've been sitting in our corner of the world treating this, we never stopped giving hormone replacement because we know that hormone replacement is important for bone health, it's important for cardiovascular health, it's important for brain health, and so that's why we give hormone replacement.
So, I know, Dr. Davis, I can't help but think the parallel here. I'm a big proponent of testosterone and a testosterone replacement, and our mutual friend Mohit Kara is a big believer in testosterone replacements. It's done wonders for me. And the same thing, I get people emailing me and say, hey, my general physician, who hasn't kept up with developments in this, says I'm going to get prostate cancer if I do it because of one study forever ago that said that, and now most people don't believe it. And it's very frustrating because it seems like there's a strange parallel between this, because I think a lot of women do need hormone replacement for them to be happier and healthier and have healthier marriages. I see a lot of guys divorcing their wives because they think she went crazy. She didn't go crazy. Her body is working against her. Am I right in that?
You are correct. So there was even a time when OB-GYNs were taught that cognitive behavioral therapy would help hot flashes. But if your body is having a physiologic reaction, you can't talk it out of a hot flash. You cannot talk your body out of having a hot flash. So there's exactly that women struggle and suffer with hormone fluctuations that, and for a long time they're ignored anyway because they're trying to get pregnant during reproductive age. And there's during pregnancy, you just have to deal with that because your focus is on being pregnant and protecting the baby. But post-pregnancy, women are struggling with all these hormonal fluctuations. And because they've been sold that hormone replacement is not good for you or can be harmful to you, many women avoid They avoid, not only do they avoid hormone replacement after menopause, but some will actively avoid birth control pills and treatments for their hormone fluctuations, which are really affecting their day-to-day life. But sometimes this is nuanced, right? Like you have to get in there and understand where these hormones can benefit you.
Well, it just strikes me that a lot of married couples divorce after they've been through the toughest and maybe most rewarding years of their marriage. That is, their kids leave high school. And the thing I hear men say in the locker room, at the cigar lounge, at the bar is, I just couldn't deal with her moods anymore. And I think, man, you built a life together. It's one thing if he's running off chasing strippers or he's running away with his secretary, but when he can't be in the house with her because of the mood swings and the hot flashes, that's a horrible, horrible thing to lose a marriage over that. Hold with me, Dr. Anu Davis. We're talking about menopause coming up.
Hell yes, we're going to take your AR-15.
B-E-T-O Beto.
The Michael Berry Show. Hell yes.
Dr. Anu Davis is our guest. She is passionate about the treatment of women with menopause. She's a concierge doctor. She's actually my father's doctor. No, he doesn't have menopause. He's 85 with diabetes. But she's a concierge doctor that is your general practitioner. That means just your primary that you go to for whatever else, with a specialty in endocrinology. And that's all your glands and hormones and all those sorts of things. And she handles my dad's diabetes, and may I say masterfully, which is not an easy thing. And she handles and focuses on menopause. And we decided it was time to have that conversation in public. So, Anu, I guess I'm going into the soft science opposed to the medical science. I want your expertise. One of the things that bothers me a lot, and I will confess this, is to watch couples who are 53 to 65. They got the kids through high school. They seemingly had a solid marriage. And then he says, I'm done with you. Or maybe she thinks she wants out. And then he may go off and remarry, but she's miserable. And all of that is lost. And the kids are sad because their innocence and their childhood is lost. They didn't fight all those years. I think it's this hormonal imbalance. Can you speak to that?
I mean, there is a significant amount of dysfunction that happens, right? Like if you're not able to sleep, and then you're not able to have conversations, and then sex is painful, and you're not able to have those conversations with your partner, then the health of your relationship declines. And that, from the testosterone side, that becomes a thing that the whole marriage has to be treated, right? The sexual health of a marriage has to be treated. But some of that has to be treated. Each person has to individually be healthy. So these women, they're suffering, right? They're suffering because they can't think straight and they can't sleep, and sex is painful, and they're not able to fix it, and they go see their doctor, and their doctors have said, well, I mean, there's not really much we can do. And then when they get that answer, they do feel like they're losing their minds, right? And when that happens, I mean, how they aren't able to communicate with their partners to talk to them. So it is part of it, right? The relationship has to be treated, and that can contribute to that, and it's a sad thing to see.
You've spoken generally about treatment. What does treatment look like? So give me I know there is no standard patient, but lady walks in, roughly what age is she most likely to be if she walks in, if I'm building a profile? Why did she come to you? How did she know she had a problem? What are the tests? What's the diagnosis? And how are you treating her? I got 5 minutes in this segment.
So the average age for menopause, for when the periods actually stop, is about 51. I would say most people come to me in their mid-40s starting to notice certain symptoms. They start to notice hot flashes and night sweats. Everybody's different. Other things people notice are joint pain, pain with sex, brain fog. So people come for different reasons. And they start to notice some irregularity in their cycles. When they show up, the main way of figuring this out is by history. We do labs to make sure that there isn't something else causing these symptoms. And then we start really thinking about, and we do take a history to learn about how her cycles were before and how things have changed, and all the way through pregnancy. So all that stuff, it makes a difference and helps us prepare for the transition through menopause and determine what the best treatments would be. So in addition to using hormones as treatment, which are very useful in treating the hot flashes and some of those symptoms, then we also assess risk for health for the long term, right? We also want to increase nutrition, and we also want to improve exercise, because hormones can do a lot, but they can't fix everything. So in order to help overall health and prevent complications and keep women stronger for those last 30 years of their lives, we spend a lot of time, in addition to talking about how hormones may be part of the treatment, but also nutrition and also exercise.
Why is nutrition important to menopause? Because that's a question I received a lot of emails from listener women 50 to 80 about. How does that affect it?
Because one of the biggest things that we have to do in the last part of our life is keep ourselves mobile. And in the most important thing in keeping ourselves mobile is maintaining our muscle mass and preventing fractures, okay? And hormone replacement can help us with maintaining our bone health, but to maintain our muscle mass, we have to focus on nutrition. We have to focus on nutrition in new ways that maybe we haven't in the years before, and we have to try to make up for what we messed up, way back when.
That's interesting.
In all the years we weren't doing it right.
That. I was talking to Stan Dukeman, our mutual friend, the cardiologist, and we were talking about strategies for good health, and especially as you get older. We were talking about my dad's health, and he said, Michael, I can't figure out a good way to say it, but what we want to do, we're all going to get sick. And what we want to do is get the body strong enough that when that sickness hits, we've got some reserves to draw on. We've got good core strength.
Yeah.
We've got low body fat. We've got good muscle and bone density and these sorts of things. Let me ask you this, a minute left in this segment. Hair loss, and I'm trying to kind of make a composite of questions. A lot of questions about hair loss. It sounds like that's
hair
typical.
Loss, yes.
What can be done about that in your treatment?
We do have to dig in to do a little bit of search for what is causing the hair loss. Hair loss is common with menopause. Hair loss can have a genetic component, right? If it runs in your family and everyone has that male pattern baldness, there's not as much you can do about it. But nutrition is important, protein is important, and then there are some other medications and topical treatments that can help.
When you talk about these treatments, I'm going to be up against a break here in just a moment, so I will ask you and we'll address it on the other side. How are these being delivered? Is this a pill regimen? Is it typically one pill a day? And I know that's going to vary, but talk about the composite. Is this shots? How often are those shots? How often does a lot of people, I think, are afraid to engage in a relationship where it's going to be, I'm having to come to the doctor every day. Or is this a one and done? What does that look like? I'm assuming you have to adjust those. We'll continue that conversation with Dr. Anu, A-N-U, Dr. Anu Davis, a Houston concierge doctor, endocrinologist, diabetes expertise, and we're talking menopause.
What a maroon.
The Michael Berry Show.
What an ignoramus.
So it strikes me that menopause is something that my mother suffered horribly from during my teenage years. And I'll be honest, and I've told her this, and we've had deep conversations. She passed September 19th, but I left nothing out and she left nothing out. I resented her. I resented the crazy woman who took over my sweet mother. I adored my mother. And there was this period of time that this awful monster took over my mother, my mid-teenage years, 15 to 18, and I didn't like that lady. And then at some point, that person got bored of her and moved on to the next lady. Maybe it was your mother or wife. But my mother didn't have access to all of the great medical advancements we do today, and an expert like Anu Davis, who is our guest. That's spelled A-N-U, Anu Davis. And we're talking about menopause. Let's talk about hair loss, because that was one of the many questions I have in my stack. And by the way, I was shocked how many women reached out and were willing to say, yes, I want to know more about menopause. It's upsetting me or my mother. So let's talk about that.
Yeah, I mean, the menopause question is kind of a crazy one, right? Like, I remember back, I was a baby doctor, and I was doing a house call at maybe when I first started my practice, 10 or 15 years ago. And I was doing this house call on the Saturday morning, and I was seeing this little 81-year-old woman, and I told her I was going to give a talk after I finished her house call, and I was going to give this talk about menopause. And she's like, "You don't lie to those people." And I was like, that's funny. I just can remember her saying, "Don't lie to them. Tell them the truth." And I said, okay, well. And, the truth has changed, and we are learning more every day. And having been able to having this change in the guidelines in this next year is really going to help women, okay? The Menopause Society and the UK societies that write about menopause actually changed the guidelines in 2024 and took back all the initial recommendations from 2002. So because of this is why this is so important now, and why we're trying to do our part to educate, all the internists who have to see patients all day long and who want to be able to treat their patients well and give them good treatment, but didn't have the knowledge up until then. So the way that this looks is that the history is the most important thing, right? First, we take a long history and we try to understand kind of how each patient has done through her cycles, and then how her menopause and how the transitions are affecting her. And then we aim our treatments specifically at helping her and also preventing disease in the long term, keeping her strong and healthy, protecting bones, protecting her heart, protecting her brain, and making sure that she is feeling in control of her
Let's talk about the bones first. My mom had severe osteoporosis, so she was on a pretty heavy calcium treatment. She had one fall that messed her back up. She had to have a surgery. She got on a darn stepladder, like they shouldn't be doing. We all know. But in any case,
it happens.
But
for sure.
The bone strength, I have a trainer, Michael Petru In-Home Fitness, and he trains a lot of elderly folks. And a big issue there is avoiding falls, because, you've seen it happen. You fall, you break your hip, you never really recover. And people say, the last 3 years of his life were horrible, or her life, because of the hip never really fixed. How much can you do to fix? I'm asking one by one. The bone strength, the bone density, depending on how bad it's degraded.
So when we see women in their 40s, we have medications that help us build bone. If we're able to start hormone replacement before we are at menopause, bone density decreases significantly in the first 36 months after menopause. So if we're able to start hormone replacement to where they never lose any estrogen, we're able to protect the bones that they've built up to that point, and we don't see that loss. And we're able to intervene early to prevent fracture. We actually have lots of tools for fracture prevention, but if women are able to start hormones to where they aren't deprived of these hormones, because realistically, when we talk about hormone replacement therapy, we're replacing something that their body's just not making anymore.
Which is just
because
crazy.
Their body's not making anymore doesn't mean they can't benefit from it, right? So they benefit from it. Their body just stopped making it because of, where we came from, and because before we only lived to 55 or 65, and once we were done reproducing, we were finished, right? But that's not where we are. We're replacing something our body's not making anymore. So if we do that before the bones feel the depletion of estrogen, so if we get that early, then the bones don't deteriorate in that initial postmenopausal period.
And so what's the delivery mechanism? Is that a pill? Is that a shot? And how soon do women start noticing a real change in life, from the hot flashes to feeling better to a better, and I'm assuming most of this is estrogen, but can you speak to that?
Sure. So there's 3 hormones. The main 2 are estrogen and progesterone. Okay. The estrogen is the one that's responsible for protecting the heart and protecting the bones and probably protecting the brain and protecting the colon. And so that's the main hormone that needs to be replaced. If women have a uterus, we give them progesterone also to protect their uterus in the menopausal time. The medications can be given by pill, they can get by patch, they can be given by cream. And so some of that is preference, and some of that is just kind of what works for people and what works for their day-to-day lives. But the medications are the same. It's still, we're just replacing hormone that their bodies aren't making. So the form is just a preference issue.
That brings me to the next question. You said if they have a uterus, meaning, of course, that if they don't have a uterus, they've had a hysterectomy, which my mom had. And by the way, if anybody out there is wondering, why is he throwing his mom under the bus, given her medical history? She was interviewed by the local news about all of this in Beaumont. She was happy to talk about it. She was a little ahead of her time in terms of being willing to talk about women's issues when other people wouldn't. She was a tough woman. But we will talk about post-hysterectomy and treatments for that. Yeah, we're actually talking menopause with an expert, Dr. Anu, A-N-U, Dr. Anu Davis. There's reasons women can be crazy. Us guys, when we're in a locker room, we have these conversations. And whether we're right or not, and regardless of if it's obnoxious to women, that's how we talk and how we feel. But there is a certain moment at which, for many men, and my dad went through it, and we as teenagers did, where you feel like, man, mom or your wife, she's just not the same. And I don't like this person she's become. And somehow she goes from yelling at me and accusing me of things and judging me for everything to me saying I've had enough. And all of a sudden she's the victim and she's crying. And now I'm a monster. So menopause may be a part of some of that. That's one of the reasons I want to talk about this. And because a lot of women, when I mentioned the subject, said, thank you for bringing this up, because I think a lot of women are not getting treatment for this. They've never sought medical treatment. And I would at least like them to know what's available for that. Because, hey, we only get one life. Why not have the best one? And I'm not one for a lack of personal responsibility, quite the opposite. But you got to understand, if most really fat people eat too much and don't exercise, but there are that very small group of people that have a thyroid problem, and they're going to be really fat for those reasons. Let's talk about how we can help people, what options are out there, And that is a lot of women at a certain age. That's why our guest is Anu Davis. ANU is how you spell it. Dr. Anu Davis. She's River Oaks Doctors Group. And this is one of her areas of expertise. What was the last question I asked going into the break, Ramon? Can you stay with us? Was not the question, you goof. Rewind the tape and tell me. Anu, do you remember do you remember the question?
I mean, these are the questions, right? What are women feeling? How do we treat it? And how do they need to advocate for themselves. Right now, their doctors haven't had the tools, right? And so that's kind of what is, how can they advocate for themselves a little bit so that they can get the treatments they need, because they're out there.
So I'm sifting through these questions. So they call it HRT, hormone replacement therapy. I don't know. I'm taking notes and trying to ask the questions that people ask me to ask because they're living it. I'm more just kind of curious. Are we talking mostly estrogen? What are these hormones that we're replacing? And forgive me if you said it and I was looking for other materials.
Sure. So we are replacing estrogen, progesterone, and sometimes testosterone. Mm-hmm. Okay. The main hormones that are replaced are estrogen and progesterone. And then testosterone is also replaced in many cases, but because it's not FDA approved in the United States for women, it becomes a more nuanced thing that you need to go to specialists who do this to get testosterone therapy for women. And so that's why it's not as mainstream. But the hormones that we replace are estrogen and progesterone. And the idea is that women at menopause stop making these hormones, and there is some clear advantage to replacing these hormones that we're no longer making. Because when these hormones are depleted, we see a very clear and bone loss very immediately, like within 3 years. We see increase in cardiovascular disease. We see increase in Alzheimer's. And why would we stop replacing this at age 51? Like, why would we want to increase the risk of all these things when all we have to do is replace a hormone that the body's not making anymore?
So hear me out here. I have had folks who read a lot about this, including a doctor who shared with me, who shall remain unnamed, said to me that the body begins the dying process long before you die. And that, remember, we're built on a chassis for 2,000, 3,000 years ago. So we're living in an age where we're living, in some cases, to be 100. The body wasn't prepared for that. So the tires are wearing out. The transmission's giving out. The starter doesn't work. So there's this idea, according to a number of people, it's kind of a school of thought, that you're beginning to die, your body's beginning this shutdown process, and the loss of hormones is part of that. The theory being the replacement of the hormones is kind of like CPR, like, no. We got not only some living, some good living to do. Our friend Mohit Khera is coming out with a book called Sex Span about the fact that, older couples that are married still want to have sex, but they want to have enjoyable sex. And that's part of the relationship. And that a lot of these hormonal issues are preventing that. And so the idea is if they want to have this kind of relationship as they get older, that's an expression of their love. Let's help them get there. So I will move to the question of sexual dysfunction in women as they get older. You kind of mentioned it earlier, pain, dryness, lack of enjoyment, lack of drive. Could you speak to that?
Sure. So not uncommon at all as part of the hormones being depleted, the estrogen being depleted, the progesterone being depleted, the testosterone being depleted after menopause. Women experience a lot of pain with sex and lack of libido. So we want to address those things if they're able to be addressed. And in addition to that, when the women see changes in their vagina, the risk of urinary tract infections and illness actually goes up too. So there's medical reasons in addition to sexual reasons and feeling and well-being reasons to replace these hormones.
We have a very popular host on the air in Houston named Dana Tyson. She's on Sunny 99.1. And she, over the years, has mentioned vaginal dryness. She's a very attractive woman. And I jokingly told her in the hallway one day, I said, Dana, please don't ruin my fantasy. Every man in the building has it out for you, and then you got to go and start talking about that stuff. And she said, Michael, that's the whole point. That's why I have to talk about it. But she has spent a lot of time over the years talking about an aging woman and the sexual process and all this. Is that something that can be fixed?
It is something that can be fixed, but it's better if we prevent it from happening. So if we start hormone treatment earlier, so closer to when menopause starts, within 5 to 10 years, we prevent these things from happening. And that's kind of the bigger point of all this, is to prevent it, right? To not get there to where we have vaginal dryness and pain, and we've been suffering for 5 years or 10 years. And we're just getting crankier by the moment, right? And we're not thinking straight. If we can catch it as it begins to happen and treat it in that time, then we prevent the stuff from happening.
Hold right there. Dr. Anu Davis is our guest. That is spelled ANU if you want to look her up. We're talking about menopause coming up.
The Michael Berry Show.
He's just perfect.
I don't want to sit in a recliner, get old and fat and grumpy and say, get off my front yard. I see people who choose to live an active life well into their 90s. I look at the work that Clint Eastwood has done that will be left to humanity from the time he was 70 to the present alone, right? And that's amazing. And I think he's having a great run. And I think the mindset that, you know what, I'm not just going to fall apart. I'm going to make decisions. I also find it to be the case. Look, I'll cut jokes with the guys as well, but we all know we love our wives, we love our mothers, we love our daughters, and we want good things for them. We want them to be happy, not just in their relationships, but personally and individually in their health, including their mental health. And some of that's related to their physical health. And look, we love to say, oh, she's being hormonal. Well, guess what? She is. But I will tell you, full disclosure, before I was on testosterone, I was grumpier, and I was younger too, over 10 years ago. Now, if I go a while without getting my shot because I get busy and all that, I'm grumpier. I'm not happy. I get back on my testosterone, and I'm driving along, and I hear the birds chirp. I'm not even joking. When you replace my male hormone, I hear the birds chirp, and I think, what a beautiful sound. Anybody that knows me knows there's two Michaels, Jekyll and Hyde. There is, what a beautiful sound the birds are chirping, and there is, doesn't even hear them and wonders why the world's going to hell. I like that me more. And it turns out it's also true for women. It's the natural drug your body makes. Dr. Anu Davis, I'm going to open up to what are the questions you get the most related to menopause, the loss of hormones, the aging process for women, and what are some standard things you want women to know?
So the biggest thing that people want to know about menopause, especially right now, is hormone replacement therapy safe? And the answer is that for most women, hormone replacement is not only safe, but it's beneficial. I want women to know, and women often ask, when is too early, when is too late to start hormone replacement therapy? And the answer is it's never too early to start hormone replacement therapy or start talking to your physicians about the changes that you're feeling with hormone replacement therapy or with your cycles or with your changes in your cycles. But the hope and the goal is to start hormone replacement therapy for menopause if you're able to start within 5 to 10 years of menopause. The sooner we start it, the more likely we are and the more able we are to prevent the complications related to the bone and to the brain and to the heart. So our hope is that we can start it as people are transitioning or as soon after the cycle stop as possible. The second question that everyone asks is, how long can I take it? And the answer to that question is really indefinitely. But the risk has to be assessed year to year as other health issues come into play. And in women who have active breast cancers or in women who have active heart disease, then the risk and benefits of the hormone therapy has to be weighed.
I didn't know if there was going to be a third one. I was pausing.
I don't know if there's a third one.
Oh, yeah. Okay, go ahead. Good.
Those are the two. I mean, those are the big ones. Like, when do we start and how long can we take it, right? Those are the two big questions people ask.
Is this, hold on, let me stop there. Let me stop there because I think a lot of people are asking, a lot of people are on a budget, maybe a fixed income. Mm-hmm. Is this the sort of thing that insurance covers? Yes. I know you're a concierge doctor.
Hormone replacement therapy. Yeah. No. Yeah. There are many FDA-approved hormone replacement therapies, and yes, insurance will cover the majority of hormone replacement therapy.
Is that true also in your practice since you're a concierge doctor?
It is true, yes. Okay. So testosterone is not covered by insurance for women because testosterone is not an FDA-approved therapy in the United States. So women who choose to use testosterone therapy will have to pay for that. Although there's it's not a new medication. It's not like we're using fancy testosterone. It's a very affordable medication. So, but estrogen and progesterone replacement is FDA approved and
I will tell you, I want you to go to number 3, but I would tell you, I have had Mohit Kara, our mutual friend, my urologist, on the air multiple times, and at some point it comes around to testosterone for women, obviously in limited amounts. And I get emails from dudes who have never heard of this, and they think their wife's going to grow hair on her boobs, and it's not happening. And not only that, it has been shown to have phenomenal results in many women. And if you think about the fact that women, as they get older, their body is as far from you want muscle mass, you want some strength, you want all those things that are represented by testosterone. So, ladies, don't be freaked out by that. I've read a lot on the subject, and I am personally a non-doctor believer. But what was number 3?
I don't know. Oh my gosh. So, when should we start it? How long can we take it? And then people want to know what they can expect, right? The doses of these medications do have to be adjusted. Depending on how often your physician does this, like it may take a couple of tries, so be patient with it. And depending on how you respond. But remember, we're replacing hormone that your body doesn't make anymore. We are not, we're not giving you something else. So it's just replacing something that your body stopped making.
Was there another one?
And then I don't know. I can't remember.
That's all right. So let me ask you this. I'm just sifting through all the questions I had, and I had made a lot of notes, and I can't get to all of them. But one of the ones that came up a lot is if a woman was on the pill, is that going to affect her? And I found a post by a fellow who is kind of a bodybuilder, wellness guy, and I'll just read you the quote. That coming up with Dr. Anu Davis, A-N-U, Dr. Anu Davis.
Listening to the Michael Berry Show podcast is sexy. Be sexy.
Her name is Dr. Anu, A-N-U, Davis. She's in Houston at the River Oaks Doctors Group, and she is an expert in diabetes. She's a concierge doctor, and she is a menopause expert. And over dinner at our home, she mentioned menopause, and my wife said, get her on the air. Women want to hear about that. Whether you like it or not, we're all interested in it. I said, okay. So we did. And my next question is, or so we are, as we speak, my next question is related to birth control. And as women get older who have been on birth control earlier, obviously, if you're perimenopausal or menopausal, you're not having your period anymore, so you're not getting pregnant, presumably. But here, I'll just read you a post and we'll start there. The use of hormonal contraceptives by tens of millions of women could plausibly be having population-level effects on behavior, including political behavior. A new study shows that women who use hormonal contraceptives exhibit significantly stronger emotional responses than women who are naturally cycling, and they also, interestingly, remember fewer details of negative events. A study last year showed that hormonal contraceptives shrink the ventromedial prefrontal cortex, a region of the brain involved in fear processing and emotional control. Are hormonal contraceptives making our ladies crazy, and what are hormonal contraceptives?
Okay. So hormone. So the hormone that are in most hormonal contraceptives are actually different than the hormone that we use in most hormone replacement therapy. In hormone replacement therapy, we use I hate the term, but we use hormones as much that are not artificial. The hormones in birth control are similar to what your body makes, but the hormones in hormone replacement therapy are much lower doses, and they are probably about 30 to 50% of the doses in birth control pills. And they are actually a different compound, replacing the hormone that your body makes. So we give women in menopause estradiol and progesterone, which is a little bit different than the actual medications that we give in birth control pills. But I don't know that I addressed the actual question.
Well, that's okay. Take a moment. I mean, what effect do you think that does have? I'm coming at it, and so is the fellow who posted. I don't know him. He's Raw Eggs National. I don't know what that means. I don't know who he is. Could be anyone. But this idea, well, I'll just lay it out there. I'm not one to mince words. There is this idea that there are a bunch of screeching women out there who can't be reasoned with, who are voting by our calculation. I don't ask you to address politics, but by our calculation, they're unreasonable, and they're voting, we believe, wrong. You take the woman who, at the Phillies game, who's come to be known as Phillies Karen, takes the ball away from the kid on his birthday, and now everybody hates her. You know, there is this idea, and I think people are concerned about it. Now, it's mostly coming from men. Fairness, we have our own perspective. We don't have a lot of tolerance for the emotional side. But I'm curious to know if you think that is affecting, writ large, a lot of women.
I don't think that it's affecting a lot of women. I don't know, like, that there's the use of birth control pills has gone down significantly, probably in the last 20 years, because of the same fears that have reduced hormone replacement therapy. That most women, after the short periods that they need to use birth control pills, have actually stopped using them. So I don't know that this is some global occurrence, but I don't know that I can really speak to it either.
Okay, fair enough. Did you speak to how long a woman should be on this sort of treatment? I mean, a woman enters into this perimenopause where she's not cycling, as you say, any longer, and then a woman, I guess you treat this. Is this a treatment for life? I mean, how long is it reasonable to be on this?
So it is reasonable to be on this medication indefinitely, as long as you don't come up against things health-wise that make you have to stop it. So right now, the things that would make you have to stop taking hormone replacement therapy is if you have an active breast cancer that has receptors for estrogen or progesterone. So women who are diagnosed with active breast cancers that have receptors for estrogen, progesterone, they should not take birth control. Women who have active heart disease, meaning they just had a heart attack, they just had a stroke or a clot of some sort, those women should stop their hormone replacement therapy. And so sometimes we have to stop it. Those women at this time, we can sometimes restart it, but that has to be done on an individual basis. It is not unreasonable, however, to plan on taking these medications indefinitely.
And that's okay. It sounds like you're saying that's okay.
Yeah, that's great. I mean, as long as it's helping them and protecting their bones and doing what it's supposed to be and not hurting them, we can stay on it indefinitely.
So let's talk women's health generally for women 50 plus. If somebody is under your treatment, then you get an opportunity to talk through all of these things. And being a concierge doctor, you don't have to see 75 patients today. That's the reason people pay more and pay cash outside of insurance for a concierge doctor, is to be able to sit down and talk to you at length. Everybody's been in that doctor's office where he's got, you waited 2 hours to get in to see him, 2 hours over the time, or her, and then they've got 30 seconds for you. They can write you a script and send you on your way. That's the reason people go to concierge doctors, because they can sit down and talk through, hey, I'm having hot flashes. Hey, this is my worry. Let's talk women's health generally. And
sure.
I want to talk. It's going to take me a moment. I'm going to have to go to a break here, but I'll tease the questions to give you a moment to think about it. And that is diet. I have become mildly obsessed with diet, not in terms of the word that we used in the 70s and 80s, as in lose weight, eat less, fat-free, sugar-free, whatever that. I want to talk about diet. My wife's a big believer in this Mediterranean diet, and the idea that you don't have to eat, you don't have to starve, and you don't have to eat tiny amounts, and you don't have to eat, products that are tasteless. In fact, quite the opposite. You can eat God's bounty that he put on this earth for us, very natural, tasty, in some cases high-fat, good fat foods, and be way healthier than people who constantly say, oh, no, I couldn't eat cake. I'm on a diet. And then that self-denial leads to them later gorging on 4 pieces of it. When we talk about overall good health, it doesn't mean you have to be miserable and in a state of constant self-denial. I think it's important people understand that. We'll continue our conversation with menopause and diabetes concierge Dr. Anu, A-N-U, Davis.
Easy one-button tuning, all for just $499 right now at Ward's. If you can find a
Mr. Michael Berry
with these features for less money, buy it.
Dr. Anu Davis is our guest. She is a concierge doctor in Houston who treats my father as of the last few months, and may I say masterfully. She is a diabetes expert. She's a concierge general practitioner as well. And if anybody's wondering what that means, I'll give you the quick rundown. And that means instead of going to a doctor, waiting for 3 hours to see them in the waiting room, rushing in, waiting in another room, they come in, hi, how are you? What do you need your script for? They write you a script, send you on your way, and you feel like, whoa, I needed to talk to him, and you're out the door. But the insurance covered it, and that was the good thing. Concierge doctors are not for the faint of heart. It's not cheap, but it's not that much when you consider what you get. You have their cell phone in most cases. You can call them all hours a day. Instead of seeing 75 patients in a day, they typically see 5 or 6. So, she spent an hour and a half with my dad at her first meeting. I like that. I'm willing to pay for that at this point at 85, for him to sit and talk through every aspect of his life. That's what a concierge doctor does. She does that as your family doctor, as your general doctor. She's a diabetes expert, and she's a menopause expert. They're all kind of in the same field of what's going on with your body. We talked a little bit about women's health going in, and I posed the question about a proper diet that is also enjoyable, because nobody wants to be miserable. Talk about what we should and shouldn't be eating if we're a 60-year-old woman.
Well, the main things that we should be doing is focusing on strong, not skinny, right? The goal is to increase protein intake to protect those muscles from breakdown because then the muscles protect the bones. So we want to eat um, we want to focus on our protein. We want to focus on fiber and vegetables, and we want to avoid foods that are pro-inflammatory. So inflammatory foods are things that have artificial dyes, um, and that will make us sick, right? So what we want to eat is as much real food as we can eat. We want to focus on protein and fiber. Um, and when we do that, we become stronger. And that's what I try to focus my patients on and focus myself on is just, cut out the stuff that we know we have no business eating anyway and eat more real food. That's step one, is just eating more real food. So Mediterranean diets are great. I think you said that that's what you like to do, and that's great, right? Lots of lean protein, lots of vegetable, but strong, not skinny. That's what I tell people.
No, Anu, I want to be clear. My wife is an aesthetic, a health nut, a very disciplined saint. I am not. I don't want you getting the impression I eat properly. I said my wife does that. You know my wife. She is very disciplined. I am not. I don't want to get credit for something I don't deserve. But anyway, go ahead.
Well, that's where our focus should be, because the nutrition does matter. It makes a huge difference in terms of our overall well-being and protection of our bodies.
All right. I want you to tell me
the thing about menopause.
Okay, go ahead. Go ahead.
Go ahead. What?
No. I'd rather you finish.
The thing about menopause, and that without changing anything, when women transition to menopause without changing anything in their diet and exercise, their body fat increases by 10 to 15%. So you're talking about, so take someone like your wife who's healthy and who does all the right things, just making that hormone go away as part of this natural transition increases her body fat by 10 to 15%. She's going to be mad. Let me just tell you, makes people mad. When you're doing all the right things and you're eating your protein and you do your exercise and you just are gaining weight for no reason. So these are healthy women who are functioning and working and doing all the things that they're supposed to. When they gain 5 to 10 pounds of body fat because their hormones left their body, they get mad. So many times this is why they show up in my office, right? That's the first reason. Because they're like, what do you mean? What is happening to my body? I just gained 5 or 10 pounds, and for no reason. So all those disciplined women, that's when they show up to my office, is because they're mad about this. And we back up and we replace the hormones, but then we make sure the protein's intact and that they're feeding their muscles and that they're not doing things to cause muscle breakdown, and that their digestive tracts are working the way that they're supposed to, and that their guts are working the way that they're supposed to. So all those things become part of the menopausal treatment.
Let's talk about a cross-curricular expertise of yours. I'd be remiss if I didn't talk about the opposite side of my father's situation as a diabetic male, 85, a 50 to 70-year-old diabetic female. Are the treatments you suggest applying for her going to be different if she's diabetic?
So I'm sorry, how old did you say? But say a woman who's in her 40s, who's my patient, who has diabetes already, it becomes much more specific, right? It depends on how long she's had diabetes, what complications she has related to her diabetes. Where if she is a healthy diabetic who just has diabetes, we would replace her hormones the same way that we would replace anybody's hormones. If she has active heart disease or has other complications related to her diabetes, then it may become more complicated. and more nuanced.
Interesting.
But I mean, yeah. I mean, it gets so when people have other medical problems, then we have to deal. Each of those has to become a thing and come into the discussion.
I never believed my dad.
But with your dad.
Yeah, go ahead.
With your dad, he has type 1 diabetes, right? So he is a very unique person. But you would never think to not replace his insulin, right? Like he stopped making insulin when he was 20 or 30 years old, and you would never not replace his insulin.
I never believed my dad would live to be 85 years old. I am excited and thrilled to see how he has been able to enjoy so many years because of his own self-discipline, frankly, but because of medical advancements. And so I think it's important to remember as RFK is in front of the Senate, talking about, I'm an anti-vacciner. I don't ask you to speak to that, but I'm an anti-vacciner. I'm an anti-big pharma person. I'm an anti a lot of the craziness. But there are so many good people out there, folks, like this woman we're talking to, who are passionate about treating you and healing you and helping you be happy, who are respectful of your opinions, who are respectful of your boundaries, respectful of your choices, whether you take the shot or not. That's how medicine should be practiced, by people who respect you, care about you, and are knowledgeable about their subjects. Because remember, the doctor is not God, and the doctor is not the God of you. You are. It is your life and your choices. Dr. Anu Davis, thank you so much for being our guest. I really, really appreciate it.